Good afternoon and welcome to the awards luncheon for the National Healthcare for the Homeless Council. How's everybody doing today? How have you enjoyed this conference thus far? I'm interested in knowing how many of you during your time here in Washington, D.C., have had the opportunity to go on Hill visits. Show of hands, let's hear some applause with those hands. I'm seeing hands all over the room. I understand from Regina that more than 50 visits were coordinated through her, and that many more likely took place. At a couple of those visits, as many as 30 people attended. What an important time for us to be here in Washington, D.C., and what a powerful example of the integration of direct services and public policy advocacy. Give yourselves a round of applause. Now, I have been asked to remind you of our schedule for the rest of the day, and at the end of our awards presentation, I will give you a test. So pay attention. It is printed in two different places in your program, and the times for this afternoon's Susan Nybacher address delivered by Bobby Watts, and a very innovative exchange of ideas that we will be doing are misprinted in one location. So we are meeting here right after your last afternoon session at 4:40. That is 440. Can you repeat that after me? 4:40. Very good, very good. What time is that again? It's 4:40. You may see in your program, and your friend next to you might argue that it's really at 5 o'clock, and your response is, no, it's at 4:40. Excellent, excellent. We will gather here at that time to really hear from Bobby Watts, our CEO for the National Council, and to talk collectively about the wonderful ideas that have come out of this gathering that we will take home with us. At 5:30, we will join the National Consumer Advisory Board in going to Lafayette Square tonight, yes, to advocate for sensible public policies around healthcare and housing. Can you all join us for that this evening? Yes. That will follow immediately at 5:30 as we depart collectively from this hotel. Now, we hope that over these past few days that you have experienced the power of the Healthcare for the Homeless community. Have you experienced that power? Maybe for the first time, maybe you've been reminded by it, maybe you've been renewed by that power. Given the day-to-day demands of our work, there's nothing like 900 reminders that others understand the work you do, that others share your values, and as was said this morning very powerfully, that you are not alone in this work. And the thing about the Healthcare for the Homeless movement is that we often do this work without recognition, let's face it, without a high degree of compensation. And we do this work against a mainstream that often tells us that this work is unimportant. This afternoon, we pause to recognize each other for excellence in this work, and we'll be presenting awards in 5 categories. Nominations for these awards came literally from all over the country. And we will have the opportunity to recognize each of you. The awards are named after true giants in this work. And so it's a reminder to us that we stand on the shoulders of those giants, and that 32 years in after the founding of Healthcare for the Homeless, we have much work to do ahead of us toward a society in which everybody is in and which nobody is left out. Please join me in bringing to the stage Brooks Ann McKinney for the presentation of the Willie J. Mackey National Medical Respite Award. They're taking their time. We'll take this opportunity to remind you that you'll be gathering here at 4:40 this afternoon. Brooks Ann.
Hey everyone. So, I'm trying to not get emotional. Okay. In October 2016, the RCPN committee lost Willie Joe Mackey, an outstanding colleague and dear friend. I'll give a moment of silence for Willie real quick. We cannot fill the hole that Willie has left behind, but the committee thought it would be fitting to rename our national award in his honor. The Willie J. Mackey National Medical Respite Award recognizes outstanding contributions to the field of medical respite care by a person, team, or agency as determined by their impact on improved health and quality of life for people experiencing homelessness. This award recognizes those who have delivered outstanding medical respite services as well as those who have promoted medical respite programs in their communities and nationally. Anyone who has had the pleasure of knowing Willie knew he was a fierce advocate for medical respite care, so it is fitting that the first recipient of this newly named award is the incomparable Sarah Ciambrone. Sarah is one of the pioneers of medical respite care and the first person I actually met when I first got involved with healthcare for the homeless. In 1998, Sarah began as the director of the Barbara McGinnis House in Boston, Massachusetts, the first facility of its kind providing effective, dignified medical respite care for patients too sick for the shelter or the streets, but not sick enough to occupy a bed in one of Boston's hospitals. It's also known as the Taj Mahal for respite care, if you didn't know that. Sarah is a founding member of the Respite Care Providers Network and has co-authored several of the medical respite resources on the Council's website. Colleagues and friends are inspired by her compassion for others and strongly held belief that everyone deserves quality care, no matter their circumstance. Her leadership and vision have helped move medical respite care forward nationwide. And Joanne and Jim O'Connell will say something very quickly about her.
Wait, who was Sarah first? Do we know a Sarah? Okay, I'm only kidding. So I can only get a second. Sarah, where are you? Oh, there you are. Okay, so when I first met Sarah, I was afraid of her, but I'm telling you right now, she brought me here, and because of her, the respite, all the women on the respite that are in the steering committee right now told me a lot of them stayed there because of her. So I just love you, Sarah. I wish I could say more. They won't give me enough time. And so, all right, thanks. Here's Jim.
So, thank you all for we have 30 seconds, but I want to, I was thinking it was appropriate today that we would be honoring Sarah, because when I think of the giants, the women giants in the time that I've been around, I think of Barbara McGinnis, I think of Ellen Dailey, and appropriately today, I think of Janelle Goetcheus, and then I think of Sarah Ciambrone, because they are people who have come into our presence and just transformed the way we deliver care. And just to say to Sarah how much all of us at the Boston Healthcare for the Homeless program have appreciated her, I just remember the early days of moving into our brand new respite program, the new building. It was a daily drama. It has continued to be a daily drama to this day. We often thought it would be great to have a TV show that would be respite care. And the number of stories and into things would never end. But Sarah has always maintained and kept all of us sort of calm and focused on why we do all this. So every time we all got frustrated and wanted to set up a rule to prevent somebody from coming in, it was always Sarah who would say, wait a minute, let's look at where they're coming from. So there are just people in our world that have just made it fun to be around and great to be doing this work, as all of you know. And Sarah sort of rises to probably be the most delightful and wonderful person we've had working with us. And to have her run our respite program for 15 or 20 years was really spectacular. So Sarah, from all of us, thank you.
So Sarah truly embodies the spirit of this ward and the spirit of its new namesake. It is my honor to present the 2017 Willie J. Mackey National Medical Respite Award to Sarah Ciambrone.
You're still upstanding. For those of you who are associated with the respite program, would you all stand up?
All right, make me stand, I can't almost.
Just sit right here. Okay, I'm gonna move everything around.
We want to show how many respite programs are around the nation. Even if you don't work in respite, but your program has a respite program, you're part of the association. I'll be very brief. I want to say a really heartfelt thank you to Boston Healthcare for the Homeless program for trusting me to be the director of the Barbara McGinnis House in 1998 and for giving me the job of a lifetime. And then I'd like to say to the council, thank you for honoring me with the Willie J. Mackey Award, as Brooksand said, a really special and wonderful person. And it's great that there is a medical respite award now to honor the work that is so important. Respite care is truly a part and an essential part of the continuum of health care for the homeless. And it's provided a niche that is nationwide needed. And I'm so glad that despite the fact in the early 90s there were only 3 respite programs, there are now 78 known programs around the nation. And to Jim and Barry and Pooja and Barb and April and Denise and all of my other friends from Healthcare for the Homeless, it's wonderful to be with you here today. And Joanne, you're incomparable. Thank you. Thank you, Roxanne.
Good afternoon. It's wonderful to be here among all of you extraordinary individuals. I have the great pleasure to present the Karen Rotondo Award from the Clinicians Network for Outstanding Service. This award is for a hands-on caregiver who has used vision and creativity in the goal to end and prevent homelessness, and has made a significant contribution to the health and quality of life of people experiencing homelessness. The award is named for the founder of the Clinicians Network, Karen Rotondo, often referred to as the mother of our network. And what our network does is it brings all of the hands-on providers, and that includes social workers, that includes dentists, it includes peers, all of the different people who work face-to-face with people experiencing homelessness. And it gives us a chance to share our ideas, to support each other, to inspire each other. And so this is an award that's all about community, which is the word that really describes this year's recipient, Charita McCollers. So Charita, who I've known only briefly but already have been touched by, is a shining example of building community. In her direct care, she helps people access a wide range of services, from getting legal assistance to housing to addressing their financial well-being. She does not take no for an answer, and she is kindly and gently persistent until she gets what her people need. The community of Lincoln Community Health Centers is deeply grateful for her contribution to their well-being. Her colleagues say that she brings them together and helps them continue to do their work. And the community of Durham, North Carolina benefits greatly from her work on over 10 community committees, including the Advisory Committee on Homelessness. But most important is that day-to-day work. And in her nomination paperwork, one of her clients said, "Charita, you have saved my life so many times in so many ways." Please join me in honoring Charita McCollers.
Thank you.
Oh, that was a lot. And I am trying not to cry because I do really, really well when I am the cheerleader for everybody else, but not so much when I'm the object of the attention, per se. So I could not do what I do every day without my Lord and Savior Jesus Christ at the head of my life, leading me, giving me the strength, the ability, and just the awareness of me knowing that I'm working in my gift. I really do believe that what I do every day is a gift from God. And I'm grateful for it. And because of that, there's a lot of responsibilities that I take on to show and to magnify that which He has given me. I want to thank the council for this honor. I want to thank the people who are willing to take a chance on letting me come into their lives and help them get the things that they need in order to have a better journey. I want to thank Lincoln Community Health Center and Julia Gamble for taking a chance on me 6 years ago and hiring me and bringing me on to the clinic. It's definitely been a blessing. I want to thank my family for their support, but especially my son. Sometimes mommy is very, very tired, and I come home and I just want to go to bed, and he is not happy. But he deals with me, and so it was important for me today for him to be here, for him to see that when mommy is away, she's doing things that matter to people and change lives. This moment is very bittersweet for me because the people who are with me every day doing that work are not here. And so Team HCH, I cannot do anything that I do without you guys. And I just thank them for being with me in this journey and us getting together and changing lives and making things better for people in Durham. Thank you.
Good afternoon, ladies and gentlemen. My name is Rodney Dawkins, the chair of the NCAB Steering Committee. Why, thank you. Today we will present the Ellen Dailey Consumer Advocate Award. So this award exemplifies the spirit and the strength of our founding member, Ellen Dailey. This award honors a consumer who advocates for ensuring the voice of the lived experience in decision making.
Hi everybody, I'm Candy, and the person who's getting this award is my sister, is my friend. She's a mother to the community. I see her every day. She works with the community. When the women that she's actually a coworker of mine, and the women that we work with, I see her every day with the passion. And to me, Ellen Dailey represented that passion of making sure that everybody has resources, has a way that they can have somebody that they can look up to and say that will accept them. She's also, I look at her as a mother because she has her own extended family. She has her own biological family, but she has an extended family as well as grandchildren. And she's just a wonderful person. I see her every day. She pushes resources to all the women in our community. So at this time,
the Ellen Dailey Consumer Advocate Award will be given to Amber Gray in recognition of your efforts advocating for people experiencing homelessness in June 2017. Let's give it up for Amber Gray.
Not bad for a grandmother, huh? Okay, let me get my cue. Okay, this is an emotional time for me. None of us do this work to be acknowledged, and I'm so thankful to be acknowledged today for 18 years of just doing what I felt was right, what I was taught to do, is to give people time and patience to learn, and everyone is teachable. Hello everyone, I am Amber, a person with a shared experience of homelessness. I was lost for about 10 years of my life. I made choices that caused me a past experience with hospitals, jails, and institutions. I have multiple layers to my untold story. Almost everyone in this room should. I felt lost, hopeless, and lonely. I found others and built my extended family, who then turned around and helped others and supported others. I am a mother of multiple young adults who are still a part of my life throughout the country. They became my family, and my community expanded. I began giving back with at-risk youth 18 years ago in a residential homeless program. And I'd like to be brief, humble, and respectful in saying thanks to all those community partnerships that have helped support a dream to help those who aren't always able to stand alone. And a special thanks goes out to my wife, friends out of Houston, and Dr. Barry Zavin. Is he in the room tonight? Who was also my primary physician when I was homeless 20 years ago at the beginning roots of Waddell Health Clinic. I was one of the first people to sign on for primary health care and had taken hormones illegally on the streets and didn't know what I was doing. I kept getting sick, things kept happening. And they created a clinic which helped us to get some stability in our lives and manage our primary health care, which is partly why I'm here today. I'd also like to thank my supervisor, Tracy Hilton, of the San Francisco Department of Public Health, for being there and believing in me. A friend once shared a quote with me, and I'd like to share it with you today in closing. Everyone you meet is fighting a battle you know nothing about. Be kind always. Thank you.
All right.
Seth in the room? Here we go. To present the John Lozier Scholarship Award, please.
Hello, my name is Seth Ammerman, and I'm a pediatrician and adolescent medicine specialist and addiction medicine specialist at Stanford Children's Hospital in California. And my main work is that I run a mobile clinic program that provides free comprehensive primary health care to uninsured and homeless preteens, teens, and young adults. And it's a pleasure for me to be here today. I'm thrilled to be able to give out this first John N. Lozier Scholarship for New Members Award. The award allows one new individual who otherwise would not be here today, who is a member of, is an individual of an organizational member. And it's also to inspire new leaders in the HCH movement. I established this award for 3 reasons. The first is to honor the National Healthcare for the Homeless Council, NHCHC, founding executive director John Lozier. John, who retired last year, is an amazing and wonderful person. And I think NHCHC would not be the great organization it is today without his work. It has been a true pleasure knowing John all these years. The second reason I established this award was to honor NHCHC itself. When I formally got into working with homeless youth more than 20 years ago, I naively thought that the problem of homeless youth in the good old USA would be solved by now. Well, as we know, the need is as great as ever. And that goes just as much for NHCHC. The third reason is that I hope that by setting up this scholarship, that others here who have the financial means will engage in similar efforts to help support both established and new endeavors for NHCHC. Now, let me turn to Jennifer Bradford. She is a remarkable woman. A preventive and family medicine primary care physician in Massachusetts, she has taken on some of the most difficult challenges of homeless persons, those in poverty, with mental health and substance use issues, and complex medical problems. Jennifer helps these folks overcome these problems so they can lead happier, healthier, productive lives. In addition to direct patient care, she is very involved in advocacy work, particularly around health disparities in populations of color. And she regularly teaches medical students and has formal recognition as a role model for the next generation of physicians she works with. Jennifer, congratulations on being the first recipient of this reward.
Being at this conference for the first time has been an absolutely incredible experience. I've had time to reflect on my prior experiences and the future work that is required to deliver the message that everyone is deserving of healthcare. I've always worked with underserved communities, and I realize it's because I've been part of that community. During much of my life, my voice has not been heard. I've been discriminated against because of the color of my skin or because I could not afford a school lunch, or because I lived in a household that was receiving Section 8. Despite these challenges, I've been able to move forward and achieve goals that many did not think was possible. There are so many adjectives that we use to describe ourselves and to separate ourselves. There are rich people, poor people, people with substance use disorders, people who experience homelessness. But at the end of the day, we're all people. And as part of the human race, we require food, adequate shelter, security, nurturance, and social connections. And we deserve to receive these things with dignity and respect. I am so honored to be standing in a room of innovators, educators, leaders, teachers. I am humbled to have received the John N. Lozier Scholarship. Mr. Lozier had a belief that people who are homeless should have access to health care. He saw a need, and he and his supporters of this work have built an organization in which there is a fundamental belief that health care and access to adequate housing and food are human rights. Yesterday, I had the opportunity to speak with Senator Warren's staff on Capitol Hill. I was with about 8 incredible women who are at this conference right now, and we discussed advocacy on behalf of the homeless community and the transgender community. And at that moment, I realized that it is absolutely imperative to fight for what is right and what is just. Today, as a family medicine doctor, I have privilege, and I choose to use my privilege to be a public servant, to lend my voice to those who do not have the opportunity to do so. Today, moving forward, I'm determined to be proactive rather than reactive. I intend to continue the vision of John Lozier, the vision that he set in motion, and invite you all to do the same. Again, thank you for being inspirations for the work that I do.
How are we doing? I've been reminded that I neglected to introduce myself. I apologize. I'm Kevin Lindemood with Healthcare for the Homeless in Baltimore. Let's hear it for Baltimore. And for the next 8 days, I serve as president of the National Healthcare for the Homeless Council Board of Directors. And one of the great honors I have in that role is presenting our next award, named in honor of Philip Brickner, the Philip W. Brickner National Leadership Award. Philip Brickner established Healthcare for the Homeless as a national model of care for severely disadvantaged persons. Many of you have heard Barbara Kinanen tell the story of the vice president of the Robert Wood Johnson Foundation visiting New York in the early 80s and rightly being very alarmed that there were people literally lying on the sidewalk. This was surprisingly new at the time. And the person he was meeting with said, you have to go and meet with Philip Brickner, who's doing this work at St. Vincent's Hospital. And out of those conversations, with the Robert Wood Johnson Foundation, with the Pew Charitable Trust, with the U.S. Conference of Mayors, he and his team, which included Barbara Kinanen, Marianne Savarese, both of whom are here, selected 19 projects from across the country, responding to roughly 50 applications that came in from all over the United States, that established this model that we all are so fortunate enough to continue today. The program was replicated in 1987 by the Stuart B. McKinney Homelessness Assistance Act, and now includes over 300 federally funded healthcare for the homeless programs across the country. Yes. So in 2015, a year after Dr. Brickner's death, the Board of Directors of the National Council established this National Leadership Award to honor every year an individual from our field who exemplifies Dr. Brickner's characteristics of commitment to social justice, compassion, humility, inclusiveness, innovation, intellect, and perseverance. Isn't that a great collection of words? And I'm pleased to present that award today to a woman who has worked on behalf of underserved individuals in Washington, D.C. For many, many, many years. In 1979, she founded Columbia Road Health Services, a community health center that serves the poor and uninsured in Washington, D.C. In 1985, she founded Christ House as a live-in respite care facility. If anyone's had the opportunity to visit it, it is truly amazing and impressive for up to 34 sick homeless individuals. Dr. Goetcheus is also the Chief Medical Officer and Executive Vice President for Unity Healthcare in Washington, D.C. Unity is currently the largest primary care healthcare agency in the area, seeing over 100,000 patients a year, a network of 29 health centers, and Dr. Goetcheus plays so many incredible roles there. I asked two individuals, Janelle, who have had the opportunity to work with you, who are no longer directly working at Unity, but are out doing this work elsewhere across the United States, what they think of when they think of Dr. Janelle Goetcheus. Here's what I got back. Unwavering, tireless, compassion is the first thing you notice about her, and everything she does exudes compassion. Purity of purpose, moral clarity, and serves as a compass to others, certainly those who have continued your work all over the country. I had the opportunity to work with Dr. Goetcheus so many years ago, I can't quite remember, when we had organized in conjunction with one of these conferences a briefing on Capitol Hill. And I keep hearing that someone from Unity is going to come and speak, and in walks Dr. Goetcheus with a calm approach to her presentation. And I've never seen a room of elected officials and legislative aides so quieted by her powerful advocacy. And it reminded me in that moment of the true power of the National Healthcare for the Homeless Council, in that it integrates direct services that vulnerable people need with the passion and the power and the advocacy necessary to change all of these public policies that got us here in the first place. Please join me in presenting this second annual Philip Brickner National Leadership Award to Janelle Goetcheus in recognition of your profound impact on systems affecting the health of our neighbors without homes. Dr. Goetcheus.
Thank you, Kevin, and thank you.
We have a little height difference.
Just wanted to say thank you to Kevin and for him and for all that he is doing and has done in the past on behalf of Healthcare for the Homeless. This is a very special award for me because of Dr. Brickner, and I have such warm memories of being with him, as in those early days he would come and travel and be with us and sit with us. And one of the things I always remember is his saying to us, it's not just about compassion, it's also about providing quality health care. And he held us to those highest standards. And to the council, Healthcare for the Homeless Council, what a difference you've made in this nation and continue to make. And all the advocacy that you heard is going on and has gone on, and raising the needs of those folks who are often forgot, as you know, and who suffer so needlessly and are homeless. And so just grateful for the Healthcare for the Homeless Council. You should also know this has been one of the most difficult years in our life in respite care here in DC. And because there are some new legislative regulations coming on that affect us or potentially can affect us. And the first persons I was to call was Jim O'Connell and also to John Lozier. And within just a matter of a very short time, they were on the phone to the district officials. And out of that, the district officials began to believe it wasn't just us talking about it, the National Council was talking about this. So just know that when you face those challenges, they are there for you. And so to call on them, you're not alone, as I heard this person this morning spoke. I need to take a moment, though, because I don't often I'll ever have this opportunity publicly to thank several people. To my husband, 52 years, who has always said to me that all he wanted from me was whatever God wanted for me. And that is a great gift. And to my children who are here, who at early ages were brought in from the green suburbs into the city. This was in the 70s when it was a much poorer area, and to live there. And to John and Johanna, what gift they are to us, and the mother and father of 5 of our grandchildren, to Mark and Evie, who flew in from Seattle and Seeger to be here today. And so bless us. And I hear from Mark, for you from the Seattle Healthcare for the Homeless, how much you have enriched his life there. And to Ann, what could I say? She has seen patients this week, had to be on call this week, got on a flight and flew in here for just today. And what a gift of love that is. And I have several families, Christ House family, and to Eric and Lizzie and Mary and Bill, who have taken on the leadership for Christ House out of a deep sense of call, a deep sense of ministry. And it means 24/7 for them because they all live there. They live in Christ House and Cairo's house with their families. And so it means 24/7 call for them. And for my other families, my brothers who are here from Christ House, they wrote the letter in for this award. And I tell them they are our best healers, if you heard today. They bring healing to people who come to us so broken often and share their own story. For Gerald and Lawrence, who are also nursing assistants at Christ House and on the board of Christ House. For Henry, who directs that shower program, people coming in off the street, and he shares his story with them, giving them hope, and he's on the board of Christ House. For Tommy, who is on the board of, faithfully on the board of Unity. And for Jim, who, if you call Christ House, you will often hear him as the receptionist. And also for my Unity family who are here. And with Vince, out of his deep heart of compassion, he has led Unity all these years and led us into places we never thought we would be led, into provide care within DC jail, into the new renovated health services that we now have available into high schools. And I will just always be grateful to have been a part of that with Vince and his leadership. I always say if there was one thing to be told, though, of this whole story, it would be in terms of God's faithfulness that has brought this to be. So again, I thank you for this very special award, and particularly knowing we're all sitting here because of Dr. Brickner, really. We really are. And so just are grateful for this. Thank you.
Thank you, Dr. Goetcheus. How's everyone doing? Can I hear it for all 5 of our award recipients? These awards this afternoon remind me of the strength and diversity of our coalition, do they not? Yes. I'm struck by the authenticity that went into these processes and the deliberations of sorting through the many nominations, the impossible choices that groups had to make in arriving at these award recipients today. And I'm struck by the fact that these 5 individuals really represent all 900 of you. Continuing this work started by Dr. Brickner and those who labored with him to make homelessness rare and brief, and my goodness, to end it, and not just to manage it. So give all of yourselves a round of applause. We are about to head into our afternoon workshops, and then at a certain time this afternoon, what time was that? Was that 5 o'clock? Oh, at 4:40, we are coming back here to hear the annual Susan Nybacher address delivered this year by the new CEO of the National Healthcare for the Homeless Council, Bobby Watts. I know you'll want to be here at 4:30 or 4:40. You'll wrap up your workshops at 4:30. You'll have 10 minutes to grab something to drink and then to come here and be here at 4:40. After that, we will engage in an exchange of ideas of things that we will take back with us to our home communities. So think of the epiphanies that you have had over these past few days. And then at 5:30, as a reminder, we'll join the National Consumer Advisory Board by leaving from here to go to Lafayette Square to advocate publicly in support of policies that promote access to health care and housing for those that we serve. Enjoy the rest of your afternoon.